If your child has a low-profile balloon gastrostomy tube, commonly known as a G-tube, it will need to be routinely exchanged every 3 to 6 months, depending on manufacturer recommendations. Once you've been instructed and trained by your healthcare provider, you can perform the G-tube exchange at home with your child. The G-tube replacement kit includes a G-tube, stylet, lubricant, smaller slip-tip syringe for checking the balloon, larger twist-on syringe for checking gastric contents, and extension sets for feeding. At Children's Hospital Colorado, we recommend having a second slip-tip syringe available. To begin, wash your hands thoroughly with soap and water before touching the supplies or changing the feeding tube. Collect your supplies. Verify that the replacement G-tube kit is the correct size by looking at the number written on your child's G-tube. There are 2 ports on the G-tube. One is for feeding, and the other is for inflating or deflating the balloon. Test the balloon before inserting the G-tube. The number on the side of the balloon port is the amount of water recommended to safely fill the balloon to prevent leaking and maintain a good seal after insertion. Fill the syringe with the volume of water on the balloon port. Attach the filled syringe to the balloon port and inflate the balloon. Make sure to maintain positive pressure on the syringe before disconnecting from the balloon port to prevent underinflating the balloon. Check for leaks or tears in the balloon, then deflate. Next, insert the stylet into the feeding port of the G-tube. This will prevent the G-tube from bending during insertion. Now that your supplies are ready, prepare your child for the G-tube exchange. Have them lie down on their back and position them so that their stomach muscles are relaxed. To deflate the balloon of the G-tube currently in place, insert the second empty syringe into the balloon port and pull back on the plunger until you feel resistance. This will indicate the balloon has been deflated. Gently pull up on the G-tube to remove it from your child's stomach. Next, apply lubricant to the tip of the replacement G-tube. Gently slide the replacement tube into the opening until it is flat against the skin. It should be a snug fit and should pass smoothly into the tract. Then, attach your pre-filled syringe to the balloon port and fill the balloon with the volume of water listed on the device. Remove the stylet from the G-tube. To confirm the G-tube is in the correct position in the stomach, attach the larger twist-on syringe to the extension tubing and connect to the feeding port of the G-tube. Gently pull back on the syringe until you see stomach contents in the tubing. Gently inject the contents back into the stomach. Remove the extension tubing and close the G-tube cap. Check around the G-tube for signs of gastric leakage. Wipe off any drainage and dry off your child's skin. The G-tube should be flush with the skin, with enough space for a piece of gauze to fit under the tube and be easy to turn. Secure the replacement G-tube with a tic-tac-toe dressing as needed. For any questions, please reach out to Children's Hospital Colorado's Pediatric Surgery Clinic.